Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, men's health and prostate problems. We've got a urologist here. And does your smartwatch make you healthier? We're going to talk healthcare wearables and infections all around when you go back to school, including head lice. We're going to tell you how to treat it. That and the Bluegrass Community Foundation is here. Welcome, my first guest, Dr. Timothy Stark, who is a urologist with Baptist Health. Welcome.
Thank you. Thanks for having me.
All right, talked about prostate. That's the male problem it seems that everybody has when you get to a certain age. What are some of the symptoms that may make you think you've got a problem?
Well, it's very common as men age to start to develop symptoms and changes in urination. Two things occur as men age. First, there's enlargement of the prostate tissue, and then in the level of the prostate there is contraction of that muscle, and both of those lead to restriction in outflow. When I talk with patients, I describe it as simple plumbing, and so we're talking about a piping system that has a narrowing or a restriction, and that leads to weakened stream, decreased emptying, frequency, urgency, and even incontinence in some patients. Now,
when you have those symptoms, is that a sign you should see a urologist or something you should expect?
So as we age, some of those symptoms are expected. There are a few things that I call warning signs. So if men are having blood in their urine, if they're getting recurrent urinary tract infections, if they're starting to see changes in their renal function that their primary care is monitoring, those are kind of warning signs that really need to be seen. And then I also say if you're bothered by your symptoms, then that also is time for an evaluation.
Well, everybody also worries about prostate cancer. Who's at risk for prostate cancer?
That's a great question. This month is Prostate Cancer Awareness Month, and so if you're a male, you're at risk for prostate cancer. It's the most common internal malignancy in men. So about 12% of men over the course of their lifetime will develop prostate cancer. It's also the second leading cancer death in men, and so that's why we really advocate for awareness and screening. And that's a work with primary care physicians to talk about screening and get that message out.
Now, you mentioned screening. A lot of people have heard of the PSA test. Is it a good thing, a bad thing? When do you do it, or do you do it?
Yeah, so urologists would advocate for screening. There have been some recent discussions about screening and some controversy, but we would advocate that screening is important. It identifies cancers earlier, at a lower stage and grade, and cancers that are more treatable. You know, this disease is very common. As men age, with each decade, the percentages of men that develop prostate cancer goes up. And so our recommendations for screening are really between the ages of 50 to 55 to about age 70. And we recommend that screening is with an annual PSA and a physical exam.
So you still recommend the physical exam, because there's some people saying, oh, maybe we shouldn't be doing that either.
Yeah, again, urologists would advocate that sometimes a PSA may be low, but a physical exam might identify, a tumor or something concerning. And so the recommendation is for both of those things paired to try to identify these tumors early.
So if you have an abnormal PSA, abnormal exam, how do you make the diagnosis of prostate cancer?
So that's a great question, and that's where a lot of the controversy is. We would say that we should be screening patients smartly, that a single elevated PSA value may not kind of jump down the process of trying to make a diagnosis, that we really should be looking at a patient's PSA trend over time, other variables that can impact their PSA. But in men that have consistently elevated PSAs or PSA trends that are increasing or concerning, that's a guy that we would target and say whether we need to do some additional testing. There are now blood level tests, there are urine level tests, there's MRI that we use for finding concerning lesions, and then ultimately the diagnosis is made with a prostate biopsy.
That's not always very comfortable, is it?
It's not, and most men want to try to avoid it. I mean, to be honest, most men don't want to be at the doctor, and so we're trying to get this message out and convince them to be there, and then say there are some additional testing things that we can do ahead of a biopsy to try to know whether we need to and gather more information.
Well, that's great information. We appreciate you coming in. Thanks so much.
Yeah, appreciate it.
So if you've got urinary tract problems, see your doctor. We'll be right back.